Can a doctor hear your objective tinnitus? Imagine hearing a ringing or clicking sound that only you can perceive. Now, picture a doctor being able to actually hear that sound during an exam. In some cases, yes, a doctor can hear your objective tinnitus, but it's quite rare. Objective tinnitus is different from the more common subjective type because it originates from an internal bodily source that produces a sound detectable by others. This can include blood flow within blood vessels or muscle movements near the ear, head, or neck. Doctors can sometimes detect these sounds using a stethoscope or specialized electronic listening devices placed close to the ear, neck, or head. These tools amplify internal sounds, making it possible to hear rhythmic noises that match the patient's pulse or breathing. For example, if the tinnitus is caused by turbulent blood flow in a nearby artery or vein, the doctor might be able to hear a whooshing or pulsatil sound during an exam. Similarly, if muscle spasms in the palate or other areas produce noise, these can sometimes be detected with careful auscultation. Most tinnitus cases are subjective, meaning only the person experiencing it can hear the sound. In these cases, doctors relying on the patient's description and perform hearing tests to understand the nature of the tinnitus. These tests include audiometry, which measures hearing ability, and tinnitus matching tests, which help determine the pitch and loudness of the perceived sound. Since subjective tinnitus cannot be heard by others, it's diagnosed based on patient reports and audiological assessments. When evaluating tinnitus, healthcare professionals may also perform imaging tests like magnetic resonance imaging or computed tomography scans, especially if the tinnitus is pulsatil or only affects one side. These scans help identify any structural or vascular issues that might be causing the sound. Middle ear tests, such as tympanometry, are also used to check four-ear infections or other middle ear problems. In summary, while most tinnitus is subjective and cannot be heard by a doctor, objective tinnitus is an exception. In rare cases, a healthcare professional can detect the internal sounds causing the tinnitus during an examination. This makes it easier to identify underlying medical conditions like vascular abnormalities or muscle spasms that might be treatable. If you experience tinnitus, it's always best to consult a healthcare professional who can perform a thorough evaluation and recommend appropriate management strategies based on your specific situation. Remember, each person's experience with tinnitus is unique, and proper diagnosis is key to effective treatment.